Whether you're a desk jockey or an athlete, wrist pain can strike any moment, leaving you frustrated and stuck. But what if I told you there's a way to say goodbye to that frustration and hello to freedom from wrist pain for good? I will share expert tips on how to get rid of it forever. Hello and welcome to Easy Move. We believe that knowing the cause of your pain can help you eliminate it easier. Now let's cover the most common root causes of wrist pain. Do you feel pain when moving your hand? And is your wrist swollen, red, tender, and warm to touch, and you had an injury? You might have a wrist sprain or strain. Both can be treated the same way. First, put ice on it, wait 20 minutes, and repeat every few hours. Do movements that do not provoke pain. When it gets better, do 2 simple exercises to improve your grip strength, and 2 stretches to improve your mobility. Let me show you what they are. With grip exercises, you want to increase the power of muscles that flex the hand into a fist. These are located on the bottom side of your forearm. Finger extensors that put it back into normal position are located on the top side of the forearm. The first one is easy. Grab a ball that fits the size of your hand and simply squeeze it for about 5 to 10 seconds, or until it hurts, as well as squeeze it as strong as you can without pain. Repeat it 3 to 5 times. The second exercise is also simple. Put your fingers in an Italian manner and wrap the elastic band around it. Stretch the elastic outwards, trying to spread your fingers apart. Hold it for 5 to 10 seconds and repeat it 10 times. Hand sketches help you release the tension in the carpal canal, as well as help you with the general wrist range of motion. First, put your hands together and try to move your wrists lower than your elbows. Hold them for 30 to 60 seconds. With that, you will stretch your hand flexors. The second stretch is reverse. Put opposite sides of your palms together, try to elevate your wrists higher than your elbows, and hold it as long as the previous one. This will stretch hand extension. This should help reduce the pain in your wrists, but if after a few days the pain does not get lower, and it even gets worse, then you need to ask your doctor for an X-ray, as you might have a fractured wrist. Do you alongside pain feel tingling and numbness in your fingers? You might have early symptoms of carpal tunnel syndrome, a compression of the median nerve, as it travels through the wrist's carpal tunnel. There is a lot you can do to get it better, or at least prevent it from getting worse. First, I recommend that you modify symptom-provoking wrist movement. For example, proper hand ergonomics, such as placing the keyboard at a proper height. You also should decrease repetitive activities if possible. You can also use medications such as NSAID like ibuprofen. You also can use ice packs to reduce swelling of the wrist. If symptoms persist without improvement, they can worsen and lead to a range of additional problems. You may experience weakness, clumsiness, and difficulty holding onto objects due to decreased grip strength. In this case, it's essential to seek medical attention, as surgical intervention may be necessary to address the underlying issue. Do you have pain, swelling, reduced range of motion, or stiffness and weakness in the joint, but you did not have any injuries recently? Then you might have wrist arthritis, a condition that affects joints, ultimately resulting in the wearing out of this protective cartilage. Without a smooth joint surface, the bones rub against each other, leading to joint damage that cannot be repaired. Just like wrist sprains and strains, they can be treated similarly, with ice and now heat or warm water, proper exercise and stretching. However, if the symptoms do not improve, there might be a surgical method, but for that, talk to your doctor. Wrist pain can hinder your everyday living, and it can make simple tasks daunting. But do you know that is an even worse one? Watch this video on the left to know how to fix that one too.